Hello, everyone. Dr. Carter here, Family Tree Complete Care in Oklahoma City. Today, we're going to talk about the number one cause for neck pain, headaches, and back pain. And this is getting worse and worse and worse. So, is this the cause of your neck pain, back pain, or headaches? So, let's go on to the next slide here and let's take a look. We're going to talk about posture. Now, posture is how your spine, how your body is aligned. So, if your posture is crooked, that's on the outside, then what's going on the inside? Well, I'm here to tell you that if your posture's off, then your spine is off. The skeleton's off. It's off on the inside. Okay, so let's talk about just the neck specifically, because this is one of the biggest problems with posture right now. If we look over here on the left side where it's normal, this person, you're looking at their right side, so they are looking this way. So if we look here, these boxes here are the vertebra. They're supposed to be lined up on a 43-degree curve right here on that black line. But due to a number of different problems or causes, slips, falls, car wrecks, texting, sitting at the computer like we're doing right now, these different things can cause these vertebrae to shift. Now you can see right here where the red lines are on the abnormal. This is an example of a problem that's been there about 40 years. The reason I know that is because the disc spaces here are really degenerative and there's big old bone spurs here. So obviously we like to correct this before this happens. So you can see the normal curve is right here and they're all the heck way back here. So if we take a look from the front, we want to see from right between the feet all the way up through the pelvis, up through right here, up through the chin and forehead should be straight. And from the side, guys, this is very important, should be lined from that little bump on your ankle, on the outside of your ankle, through the knee, or excuse me, through the hip, through the shoulder, and through this point of the ear right here. That's proper posture up there. And I'll tell you this, any movement, any shift off of this normal posture is going to cause premature aging, nerve pressure, muscle spasms, muscle imbalance, swelling, inflammation, and premature aging, if I didn't say it, to that area of the spine. No degeneration is normal, not one little bit. So now, if we look here, we can see Mr. Posture here. We call him Ken, right? So you can see him over here. If the posture shifted, if we were to take an x-ray of Mr. Ken here, it might look something like this. So you can see the spine should be on this straight line here, but instead it's shifted over here to the right. Well, guys, that's putting pressure on these nerves right here as they come out the spine, and then it's stretching these. And nerves don't like pressure, and they don't like stretching either one. So you've heard of people having sciatica pain, pain shooting down the leg. Well, this is where the sciatic nerve comes from right here. And posture is very, very important. Way back here in 1994, a long time ago, the American Journal of Physical Medicine talked about how posture affects and moderates every physiological function. Guys, we're talking about blood pressure. We're talking about hormone production. We're talking about headache, spinal pain, mood, and even lung capacity. So posture is extremely important and it's most oftentimes overlooked. This goes way past the point of mom just telling you to sit up straight. So how you age is up to you. Now, this is Mr. Ken here, a little older, right? So you see how his ear is located right above the point of his shoulder. That's the bony point on your shoulder right here. That's the way it's supposed to be. Now, if we watch here, we'll see what typically happens these days. The head starts going forward and then it shifts forward and more forward, because the further the head goes forward, the more it feels like it weighs, the more the effective weight is. Now, this is where we're getting into the old man where you say, hey, Bob, and he says, what? Because he can't even turn his head anymore. He's probably a dangerous driver because he can't even look over his shoulder. So Dr. Callier here says that few things matter more than posture whenever you're talking about living a long, active, and energetic life. And who doesn't want to live a long, active, energetic life? Well, I'm here to tell you, sometimes you got to get off your keister and do something about it, or it's going to go down that path. So let's take a look. Remember, posture is the window of the spine. So let's look on the inside. So if we see the head shifting forward, it changes the biomechanics, it changes the wear and tear on the vertebrae here, and the disc too. So let's take a look and see what's going on. So you can see as his head is going forward, we see it on the neck. Now this is a 20-something-year-old here. The problem's been there 10 or 15 years. And then all of a sudden, we're starting to see degenerative disc disease here. We're starting to see bone spurs forming, and this is getting worse and worse. This is past the point of correction. We want to catch it before they get the bone spurs and that advanced degeneration. By the way, the only way that you know what your neck looks like is to have an x-ray, right? So let's talk about posture. Now, this is Yusuf here. Yusuf's our front desk guy. He's the one that answers the phone when you call. So if we look over here, particularly down here on the side, you can see that green line. That's just like on Mr. Ken we talked about. Should line up from the ankle to knee to hip to shoulder to ear. But you can see right here how that one yellow dot on his ear is so much further ahead than the point on his shoulder. Well, if you look over here, his head would normally weigh about 14.5 pounds based off of his height and weight analysis. But it's almost 3 inches forward, which means the effective weight, or what it feels like, is actually 56.8 pounds. Guys, 56.8 pounds is a lot of weight to be carrying around on your shoulders. No wonder why people who have this head forward posture are having headaches and neck pain, maybe even numbness and tingling in the fingers that's diagnosed as carpal tunnel syndrome or something. They're fatigued, they're not sleeping well. It all goes right back to this right here. So it's important because we know the brain controls all the functions in the entire body. So it does that by nerves that come down the spinal cord, or excuse me, the spinal cord that comes down off the brain, and then nerves that come off the spinal cord. They go all the way down to the tips of the fingers. There's your sciatica nerve going all the way to the tips of the toes. Very important though. When those nerves branch off, this is the back branch. The front branch goes to control things like your heart. It controls your lungs. It controls your stomach. It controls reproduction. It controls everything in the entire body. So if there's compression on these nerves that's interrupting that communication from the brain to the body and the body to the brain, then the brain cannot make proper decisions on what to do with the body. So that's the whole garbage in, garbage out. If your brain's getting garbage information, it's going to give garbage information back to the body, and that's how you get sick. So let's talk about what you do about it. Okay, here's a guy, Mike, chronic neck stiffness, neck pain. He had a car wreck, he had low back pain too, also right shoulder pain. You know what the surgeon says? You need surgery. And by the way, when they do surgery, they don't put this back in the healthy position. I've never seen it, not once. They fuse it just like that, so the problem's there, and then you got to fuse the level above and or below it within the next 5 to 6 years. So we can see how far Mike's head is forward right here, and this is after we get it corrected. And that's the x-rays. Proof's in the pudding. That's right where it is. Now, no more headaches, no more back pain, no more shoulder pain. He's great. You know, his whole life's back. Also works for kids. And by the way, with this text neck and this head forward problem that we have right now, excuse me, this generation that we have right now, I mean, this epidemic is going so fast right now. Just look around, people. Get your head out of your own phone and look at your neighbor. Look at your wife. Look at your kids. Look at your friends. You look at your coworkers. Look at strangers in the mall or a Walmart. Look and see their posture alterations. You can see the head is forward. It's almost guaranteed that if they don't have headaches and neck pain, it's coming. So if we look here, this poor kid here, Devin, had ADD, he had been treated with medications from a pediatrician. Well, when you take x-rays, you see how far his head is back here, and you can see it in the posture. I mean, look at that horrible posture. We get him fixed here, and all of a sudden the ADD goes away. He doesn't need these terrible medications anymore. Of course, his pediatrician just says that it was resolved, that it was coincidence. Coincidence, what it was. Okay, so here is another before and after example. You see our head's way far forward here, and then we brought it back here. I mean, that's cut like 80% of the weight of her head off, the effective weight of her head. So, look, here's the deal. This is a modern day epidemic. It's the vast majority of it is untreated. I mean, what are people doing? They're taking Advil, Tylenol, ibuprofen, prescription medications, Pepsid, all these different medications that will do nothing to correct the problem instead of even getting it checked. So what I'm inviting you to do right now is get it checked. First thing to do, email me, Dr. Carter, DrCarter at familytreechiropractic.com. Email me there, and I will tell you how you can get your posture analysis done like Yusuf. It's all free. I'll do it for you for nothing just to see what's going on. And then if there's a problem there and you want to get it checked out because you maybe decided that it's not good to live with the headaches and the back pain and the neck pain, especially numbness and tingling, then come in and we'll take a look at it. We'll do some tests. We'll take some x-rays. We'll see exactly where you are, and then talk about if you're correctable, and if you're correctable, what to do about it. So guys, I hope you found this information useful. Make sure you go to our Facebook page, like it, turn on the notifications. That way you can get all kinds of free information just like this. Guys, we're here to help. I hope if you're having neck pain, headaches, or back pain that you'll give us a call. There's no sense in living in pain. Hope to meet you soon. Have a great day.